Hello everyone, so glad that you can join us today at this webinar. We will be talking about data management, data exchange, and the relation to the regulations. Coming up very soon, starting to be implemented all over Europe. And of course, the origin of these regulations is European Commission. My name is Hille Hinsberg. I will be your moderator today, and I'm very glad that we are able to present the speakers from DG Connect and DG SANTE. But since I'm also part of the project that you see here presented, this is called IN-4-AHA, and it's a consortium of actors across Europe and dealing with active and healthy aging. And the leader of the consortium, Piret, is sitting right beside me and saying a few welcome words before we begin with presentations.
Thank you, Hille. Indeed, the question, what will be the new European Commission regulations such as Data Governance Act and Data Act bring for the ecosystem of health and care service providers and active and healthy aging? My name is Piret. I'm representing not only Innovation for Active and Healthy Aging Consortium, but also Connected Health Cluster here in Tallinn in Estonia. And the question, among others, what is really important for us every day is how to boost innovation. We have very innovative and brilliant companies who are willing and ready to provide innovative solutions for health and care sector. And we have people who actually need those services. But for some reason there are gaps, several of them, between service provision and demand. So this project Innovation and Innovation Networks for Active and Healthy Aging is aiming to overcome those gaps, to make it easier for the companies to scale up and to make it easier for the end users to actually implement those services in active and healthy aging. So, and how to use data is one of the key elements on the pathway to the real life, to the markets and to the real life for the solutions. So yeah, thank you, Hille, for organizing this event, and I'm really keen to listen to our speakers and to share the information and the knowledge with our community here in Estonia and also with the consortium members across the Europe.
Thank you. And I will just say a few practical moments how this is going to go. So we have built it up the webinar today that we will be giving you the information straight from the source, meaning I'm very glad that we can welcome colleagues from European Commission, DG Connect and DG SANTE, and they will take their turn in bringing you the very important news and insights concerning the regulations and their interplay or their interconnection. And then I will promise to be very short, but bring to you some synthesis of the stakeholder challenges and comments and their opinions that have reached us and also some other projects and initiatives going on the same topic all across Europe. And we have reserved really discussion time for you as well. So please don't hesitate to put down your comments and questions in the chat. And we will have room and space for them towards the end of today's webinar. So you can keep up the flow of questions. I will make sure to record them to make sure that they get addressed. And we will come to them towards the later stage of today's webinar. And next, I'm really glad that we can begin with the presenters. And Katja Vaahtera is the first one from DG Connect. So Katja, if you are there, please make your appearance and we will have your slides ready. And you can also click them forward or you can tell me to do it either way. The floor is yours.
Thank
Hello.
you, Hille. Good afternoon. Can you hear me?
Yes, very good.
Great. Indeed. Hello, everyone. My name is Katja Vaahtera, and I'm a policy officer at DG Connect in the unit that is the author unit of Data Governance Act and the Data Act. So indeed, Data Governance Act and the Data Act. These are two horizontal pieces of legislation implementing the European Strategy for Data, which is from 2020. It's a 5-year plan to really transform Europe into a real data economy. And now, so the Data Governance Act was indeed negotiated in 1 year. It will become applicable in the member states next, so 2023 September. And the Data Act, the Commission proposed it in February, and the negotiations are already ongoing. There are, however, 3 other pillars to the data strategy. So the funding measures, for example, under Digital Europe program, also investment in digital skills, the competencies to help people really get the best out of all the data that will be and is available. And thirdly, the setting up of the common European data spaces. And the data strategy lists 10 such data spaces, which it will also assist and promote. And the European Health Data Space is one of these. And how these all initiatives work together then is that the DGA, by creating this framework for voluntary data sharing, aims to bring more trust in such structures in the data sharing. And the Data Act, on the other hand, will actually further build on the DGA and bring more data to the data economy, thus filling these data spaces. And here you can see the interaction of different instruments. We get a lot of questions about how do our initiatives sit with the GDPR, and the answer is that they complement each other. So the DGA explicitly says that whenever personal data is concerned, the GDPR prevails. The Data Act concerns all data, personal and non-personal. And there, wherever personal data is concerned, the GDPR protection has to be provided. So indeed, on the DGA and the link to the health data, the DGA sets the 3 pillars. There's the reuse of, so secondary use of publicly held protected data. Then there is the data intermediation and data altruism. On the reuse, the DGA is actually not, it does not provide for a legal basis for secondary use, but creates, again, this framework on if there are secondary use provisions, or if it's permitted under national or EU law, then these data DGA provisions should be applied. So, for example, the conditions on the reuse. And the EHDS indeed is building directly on the Chapter 2 of the DGA. On the intermediation, that will concern the bringing together data users and data subjects and data holders. So these intermediation will be to say brokers bringing supply and demand of data together. And an example of this is these personal information management systems. And finally, on the altruism, the data altruism on the DGA is about bringing more data voluntarily for the common good. And this again concerns the businesses can do that, but so can individuals. And this can be any data, personal, non-personal. And finally, on the Data Act. So why did the Commission decide to regulate? We saw that it's important to bring more balance and fairness in the data economy, to really make the best use of the value that data generates and to distribute that value amongst all players. And this is done by balancing the rights of the users, of the data holders, but also of third parties by bringing, by allowing third parties to access more data. That would create more competition and more incentives to innovate, exactly what Piret was mentioning at the beginning of this. Whilst doing that, we take note of the importance of protecting for example, intellectual property rights, the trade secrets, and in general the rights of the data holders. So there are provisions also to that effect in the Data Act. And as another aspect of what Data Act aims to make is through the business to government provisions to bring data to be used for better policy making, to respond to crisis situations and other exceptional circumstances. And here you can see just an overview of the main components of the Data Act. So better access to Internet of Things data, the co-generated data, the contractual fairness, the business to government provisions, and then the cloud switching and interoperability. And then on the IoT data, as mentioned, we want to create this balance between the users, the manufacturers, and the third parties. And we want to go through, currently it's not, the user rights are not clear, so we want to remedy that. And throughout the whole the Data Act proposal, the SMEs are really at the core. So there are different provisions to favor them, to make it easier for them to access the data markets. And in the IoT provisions, for example, the user of a smart object would be able to request the data generated by the smart object from the manufacturer and ask the manufacturer to transfer that data to the third party chosen by the user. And in this situation, the user will not have to pay compensation to the manufacturer, but the manufacturer would be allowed to request a compensation from the third party. And this compensation should be should not be excessive. And with this rule, we aim to also, again, allow these smaller players, smaller third parties to get the access to the data, to, for example, offer maintenance and repair services, but also to innovate and come up with completely new services, whilst being forbidden from developing competing product. So with this provision, with this prohibition, we then again aim to protect the manufacturer. And the link to the European health data space in these provisions is twofold. First of all, the Data Act IoT provisions cover data that is that is related, that stems, for example, from medical equipment, but that is not covered by the EHDS. And here I talk about raw machine operations data. And accessing such data under the Data Act would allow, for example, hospitals to choose the service providers to offer maintenance to the medical equipment they have. And another link is, if you look from the user side, again, certain data that is not covered by the EHDS is data that is not defined as health data under EHDS, but that is health-related data. For example, data generated by a smart watch on about your lifestyle habits, which either alone or combined with other data can constitute health-related data, and to which these data access rules can be then applied to. Indeed, the third component, the Data Act, is the provisions on contractual unfairness, and this is of course relevant to all sectors. And we have actually two instruments here. First is the Unfairness Test, and this concerns indeed only the provisions in the contract that concern data sharing, data access and use. And the Unfairness Test is there to prevent the kind of a take it or leave it contracts. This can be applied when the one party or both parties are micro or SMEs, but also in a situation where there's maybe a more traditional situation where an SME is contracting with a bigger company. So in case if the other party imposes unilaterally such an unfair term on the SME, then the SME can resort to this article, Article 13, claiming the clause to be unfair. And there's three types of conditions, two lists in this article. So blacklist and gray list of provisions, which are always going to be presumed unfair, so automatically. For example, clauses that exclude or limit liability would fall into the blacklist, meaning that the SME would not have to explicitly prove the condition to be unfair, but they can just refer to the list. On top of that, there's a general definition of what constitutes an unfair contractual clause. And if a clause does not fall into one of these black or gray lists, then the court may interpret it in light of the definition. And another instrument that we use here is the model contractual clauses. Commission will come up, will draft these clauses with the help of experts. And these clauses can be used by anyone. It doesn't need to be an SME. And these are really to help companies take up the complex data sharing, data access agreements, and make them function smoothly. To this effect, I wanted to mention that the work of this expert group is going to start fairly soon, and we want to also engage the stakeholders in the process. The form in which the stakeholders will be engaged has not been decided yet, but I can share a link with Hille later to the website of this group, where you can follow the progress and also see how you can get involved, because it would also be very important to get the input from the health sector on these contract clauses. And here we come to the business to government data sharing provisions. There's a set of very narrowly defined conditions under which a public authority would be allowed to request data to a private company, and the company would be obliged to share the data. Now, there's three types of situations where this could apply. First is relates to public emergencies. So if there's a situation which has been declared as a public emergency under national law, the public sector body could resort to these provisions. And if the public sector body wants to obtain data to respond to the public emergency, the company would have to provide those data free of charge. However, if the data is requested for other related purposes like prevention of an emergency or recovery from it, or in other exceptional needs, and I'll come back to this later. In that case, the company is entitled to a compensation, which includes a reasonable margin. So it wouldn't be a completely unprofitable for the companies. And here, actually, on the point C, I've mentioned EHDS, meaning that such an exceptional need is indeed developed further in the EHDS, which then would constitute the sharing of data by private parties with the public authorities. And few more words on this construction of the business to government data sharing is what data would it cover, and how would this work in practice? Well, this does concern all data, but the preference is to really try to avoid sharing of personal data. Of course, if it is shared, then the GDPR has to be respected, and also, to the extent possible, the personal data has to be pseudonymized or anonymized. The public sector bodies have several strict obligations under these provisions, so they have to demonstrate the exceptional need and only use the data, of course, for the purposes which they have been requested, destroy the data after they are no longer needed for this specific purpose, and only transfer them onwards only if it is needed, for example, if they are subcontracting a function to combat a public emergency to a third party. The requests will have to be published, and this are published online, and this will then also alleviate the burden on the public on the private companies, as then the public sector bodies will have to cooperate, and also using this to see which requests are already ongoing, or whether they could, rather than going to a company, rather request the data from another public sector body. And something that is relevant again to all sectors, maybe not immediately, the link with the health is not immediate, but it is there. So the provisions on cloud switching and interoperability in general. The cloud switching, why did we want to regulate it here, is because there are issues, there are problems, both for private individuals, but for companies to change cloud service providers. And these obstacles relate to, for example, the functioning, the technical incompatibilities between the service providers, but also to the time it takes to switch, and the costs of the switching. And here, in short, we propose to abolish switching charges after a 2-year transition period when the Data Act becomes applicable, and also to cap the switching time to a maximum of 30 days. So finally, we see that interoperability is really crucial to make more data available for use, for reuse, and not only within sectors, but also between sectors, and in particular within and between the data spaces. And for that, we have a mechanism. The Data Act has a mechanism under which the Commission can, if the Commission sees that there are sectors where there are issues in interoperability, the Commission may ask European standardization organizations to draw up standards, and that is, in short, like the main purpose of these of the interoperability provisions, to really supervise and make it work. And to end this, just a word on the state of play of the Data Act. So indeed, it was proposed in February, and now it is negotiated in the Council. And we should possibly receive the Parliament's position maybe already by the end of this year. So the progress is ongoing. And thank you, and I will now pass on to my colleague Licinio from DG SANTE to speak about the EHDS.
Thank you, Katja. And yes, indeed, we do have Licinio from DG SANTE. So if you are able to carry on just as well, and we will come back to any questions and comments shared a bit later. So Licinio, if you are there and ready to go, please do. Hi.
Hello, carry on indeed after Katja and trying to bring some of the exciting news we have. While I wait for the slides to pop up on screen, allow me to thank you to the Innovation Network Active on Healthy Aging for the invite for DG SANTE to present the recently published proposal of the European Health Data Space, to which I invite you all, for the ones that are not familiar with, when the Commission announces a proposal of regulation, there is an 8-week period where you can have your say. So, and what you say will feed into the legislative process that will take part in the Parliament, negotiations in the Parliament, and also in the Council. So that's the first, how I start with a challenge. After what you hear today and after studying the proposals in the legislation, please feel free to comment and provide suggestions. Here we go. So the European Health Data Space, and if we can go to the next slide, we are living extraordinary times. And the word extraordinary comes with a sad note, taking consideration what COVID-19 pandemic meant to all of us in Europe and in the world. But taking away the bad things, that's most of it, there are important lessons we learn from regarding health data, the value of health data, and the important role of the Union to set up the standards for digital health data. And in order to keep this momentum, the European Health Data Space, the pandemic, the COVID-19 pandemic taught us a very tough lesson. And the question here that we put ourselves at the Commission is, what can we do to take this momentum forward and learn and build on the lessons we learned the hard way? And in order to do that, we found that there are 5 at least common challenges that everyone relates to. So the first one is the challenge of individuals having difficulty accessing and controlling their health data. Individuals, people like us, in very different moments in our life, we have struggled with this. Healthcare professionals have difficulty accessing data, not always simple in other organizations, but relevant for the continuity of care. In the same line of thinking, but in the other side, from the industry, from the innovation, providers of digital health services and products face barriers when they move from country to country. There are different requirements, different obligations, and that jeopardizes the free movement of services and products. And at the end, the secondary use of health data that was key in finding solutions for what we are facing during the pandemic affects, limits policymakers and regulators in the access to health data. It's very difficult, as well as researchers have difficulties, several barriers in accessing personal health data for the sake of research and innovation. So in these 5 challenges, we look at and we try to see how we can build up on the Data Act and the Data Governance Act, and in this vision of common European data spaces. And it's not we come as one of the first initiatives that presents a legal proposal. And in this legal proposal, we try to capture the rules, common standards, the infrastructures, and the governance frameworks that can support, sustain an European health data space, the ecosystem. And in that, we try to enshrine some very specific goals: empower individuals to access and control their health data, unleashing the data economy, the part of fostering a genuine single market for digital health services that possibly links very well with the work that you are doing here, and ensure consistent framework for the use of individuals' health data in research, innovation, policy making, and regulatory activities. I believe that some of the things we put as proposals are aligned with the challenges that you face, and I would like to learn very much more on what you are dealing and how this can build together. As it was presented by Katja at the beginning, the European health data space interplays with several other legal proposals. So it builds on GDPR and further develops some of the requirements and the rights established in GDPR. Regarding the European Health Union, it boosts the work on cancer, HERA, and pharmaceutical strategy by supporting the reuse of health data. As we are seeing regarding the Data Act and the data governance, the European health data space provides tailor-made rules when you're speaking about electronic health data. So if your scope, if your data that you are looking for is electronic health data, personal, we need to say personal electronic health data, that's the regulation you need to look at. It complements the cybersecurity framework, the NIS directive as well, since it introduces specific requirements, tailor-made requirements for health and digital health products. It complements Artificial Intelligence Act by providing specific requirements for when you are training AI algorithms, artificial intelligence algorithms, and interoperability for AI when you are dealing with health data. And in terms of medical devices regulation, there is a dependency on how this electronic health records, there is a mistake there, a typo there, electronic health records relate with these devices. So there are a lot of interplays, but the focus is digital health services and the reuse of the personal electronic health data. And how do we get here to this proposal that was announced in the 3rd of May 2022? We got several impact assessment studies, we had supporting studies, and all of these things are transparently and publicly available in the same site, in the same website, where you can now have your saying about the legal proposal and provide your input. So if you'd like to give more, possibly I can drop the link to that site at the end of the presentation in the chat. Now, in a very structured way, it's important for you, if you want to grasp how the European health data space regulation is organized, it's one thing you can think about is it's organizing the use of health data for healthcare, so the primary use of health data, and the reuse of health data, what we call the secondary use of health data. So these two pillars are let's say, the framework, the two sides of the coin of this legislation. And for these pillars, we go and we create specific provisions, legal provisions to empower individuals to control their data, the standardization and mandatory certification of electronic health record systems, voluntary labeling of wellness apps. I believe that there might be a good relation between the wellness apps and the active and healthy aging, and the European Electronic Health Record Exchange format, and how this can help the mobility of elderly people when moving between countries and so forth. So we can actually take over some of these aspects, if you like, to go deeper and see the connections between what this legal proposal brings in and what you are looking at as challenges. On the secondary, it introduces the concept of health data access bodies, a cornerstone for trust and security and privacy regarding the reuse of health data. I can tell you more about if we are interested in knowing how this can work. Then it clarifies and it makes very clear binding definitions on which are the purposes for use and which are the forbidden uses of health data, personal health data. And it said afterwards, it describes the process that goes through data permits, secure processing environments, and what about anonymization or anonymization of the information. So there are plenty of informations on that. I will move to, because my time is also running fast. So I would like to bring you to the attention that the estimation, our studies point out that in total, we will, if this regulation goes on, the potential for the health data economy is around 10 billion around 10 years. So 1 billion per year over the next 10 years. And this is an important growth potential that we should keep in mind. And in terms of user perspectives, and possibly I will spend much of my time in this slide because I would like to give you a better understanding on how these legal provisions are playing out. So what is empower citizens to have control over their health data? And this regulation, it starts with a very concrete right for citizens, for individuals, to say that you have, this is actually the Article 3, where you say natural persons shall have the right to access their personal electronic health data immediately, free of charge, and an easy, readable, consolidated, and accessible format. What does this mean? This means that all of us should have a way to have our data in our devices, in our control. What we define by control, the time will tell. But this is to overcome the limitation that data stays only exclusively closed in entities, healthcare providers or other type of entities, and you as a citizen, you have a right to have this in an interoperable format. GDPR already says that you can have access, but the thing, the addition here is you have the right to access your data immediately, free of charge, in an easily readable, consolidated, and accessible format. And in order to achieve this accessible format, we need to further explain, and that's what we do in the law, how do we get to this European electronic health record exchange format, which are the standards that are being used, how this information will be coded, and how this information can be exchanged between health professionals and patients. So that's one key pillar, and we believe that this can contribute heavily for innovation if this is a two-sides communication. So the citizens can receive information, but citizens can also provide the information collected through health apps and medical devices that are included in electronic health records. In the other side of the coin, and we see here down here, enable healthcare professionals to have access to relevant health data. It connects to what I was just mentioning, that relevant health data may come from other organizations, so continuity of care, but they can come also more and more from these apps and medical devices that patients are using to continuously monitor and to support them in their life. This connects very well with the healthy aging, where more and more there are solutions that support these aspects in our life. And in order to, what we want is to make sure that this data is not closed in the device solutions, that data that is collected by apps and medical devices is fed into the electronic health records. That's very important. And this is what we denominate that it can bring better diagnosis, better treatments, improves patient safety, because these apps can be, while integrated with health services, can be like emergency services, can really contribute to that. Continuity of care, no silos of information, no repetition. We tried, or at least diminished repetition of exams between facilities, and improved healthcare efficiency. So if we don't repeat things, if we go to the point and we reuse the data that we have for healthcare purposes, the gains are high in efficiency. So this is our, we could say, our left side brain, and our right side, we have the policymakers that don't need the data itself to treat patients, but they need the data to organize the healthcare systems. And we have also the innovators, so the industry, that in order to develop new products, new treatments, new medicines, they would need access to data in a way that protects citizens' privacy, but in a way that enables, boosts the innovation. And the same for our researchers, that's our academic and other type of researchers that need access to data. For them, it's not that relevant who is the person behind, but the individual and the data that it generates. So what we are seeing here is that there are legal limitations, technological limitations, and organizational limitations for these three types of actors, policy and regulators, innovators, and researchers to access data. So we put a full scheme in the legislation on how to facilitate and how to overcome the burden, the limitations we identified in our studies, and possibly some of this we share with you. So the European health data space is all of this, and some people will say, and much more when we go in detail. But I would rather stay here and open the question back to you. There are more slides in my presentation, and you'll get all of them. But I'm more interested in triggering, hearing your questions, providing some answers, and actually triggering your feedback to the Have Your Say currently open. That would be all from my side at this point.
So much, Licinio. That was indeed an intriguing overview, and thank you for that. We have no questions in the chat yet, but therefore I will make a short introduction now, presenting to you some of the bits and pieces from the research conducted by Tehda's initiative, that is the joint action supporting the European health data space implementation, and of course making their own consultations, and the stakeholder community is very active there, involved. And also the EIT Health, one of our consortium partners, has done some gathering of information exactly from the innovators on the market. So the technology providers, the health and wellness application developers, the SMEs, the startups that are already there and are eagerly waiting, let me say, to the space regulation to enable them to do their work and to scale up on the market. So I will gladly present the slides and take you through some of the insights and comments that we have gathered. There we are. I hope you can see them. And the first source that I'm going to tell you about is the collection of case studies that the Tehda's joint action has brought together from all over across Europe. So these were actually collected from the public officials in each member state, and you can easily go to the report and pull it in its full scope. But I just wanted to reflect on the main, let's say, findings, and start with the categorization of challenges and barriers that was made very clear in this report. So you can see that more than half of the challenges that were brought up were connected to legal and regulations and then policies. But on the second place is absolutely equally as important. 30% are connected to internal data management practices. So when data management inside organizations is problematic, or actually wanting to be improved, then I think it has a very direct consequence to how these organizations, the service providers in the health and care domain, are able to take up these opportunities provided by the European legislation. So just to name a few, and open up the discussion. Maybe our participants and listeners and stakeholders here do not relate to them as directly and have other challenges that they would like to highlight. But this is pre-proposal being published. And so the one of the messages was that there is still terminology missing, what is considered the secondary use. So now we know, of course, that the regulation clearly refers to that. Then there is a confusion coming from the national laws and the European Commission one. So there might be very different interpretations and practices of implementation when it comes to the GDPR. And now, Licinio, you showed the whole new array of regulations. So if member states are going to add up on a national or regional level to this layer of European as well, then the confusion might still be there. So data sharing agreements used to be a problem, and now, as we heard from Katja's presentation, the contractual terms, the standards will be coming soon. So alleviation to these kind of challenges is soon to be present. And also you can see that there is definitely a very high challenge in the semantic interoperability. So any kind of categorization of data, the meta labeling of data, the coding may still make it very, very complicated to actually talk the same language that the data set is providing. And last, but in my view not least, the data management procedures within the organization may still be not up to the perfect quality and may hamper the ability to reuse the data when the primary use for the health providing has been saturated. So from the EIT health analysis, again talking to service providers in the field, just a few challenges but also opportunities to mention here. There is still the flow, the service flow or customer journey, if you wish, going from one digital health solution or wellness application to another. So there might be a whole list of data processors and of course data users. So there might be different legal bases for the data, and this again limits the sharing, limits the exchange, limits the secondary purpose of reusing this data that is spread across the flow. So one of the recommendation picked from there is that the interaction, the interplay that you just explained is really of utmost importance and should be supported by the European Commission, as well as preferably the institutions in the member states. Going on, again, the recommendations, or you can interpret it as expectations from the domain of health and care, is that the quality of data really needs to be improved. And maybe in the framework of the European health data space, it would be worthwhile to kind of come up with a robust standard for the quality of data, and also highlighting the transparency, meaning where the data comes from, the data provenance, and the format that the data is being collected and being shared down the line. And as the regulation on the health data space is really dependent on shareable data, which means also the data quality is very important, and also that the data is findable and the FAIR principles apply. So maybe it would help for the supporting instruments to come up with some sort of guidelines to help deal with meta labeling of data, these 2 points are actually referred to by the service providers, I think with a feeling that they don't want to be left alone to come up with the solutions in-house to deal with these questions of data quality, verifying this, ensuring that that all the right standards are applied. And just a bit more of the picks. Also that maybe the skill level, the data literacy and data science capacity level is not quite enough yet. So the stakeholders would like to see continuous support and maybe not only funds but some kind of programs to help them to go along with the enablers and opportunities. And maybe even skill certification could come up as a question. And last but not least, it has been a talk in several stakeholder communities that there will be a new model of liability sharing. So who actually takes the responsibility if something goes wrong in handling the data, like some of the safeguards do not keep up, or the encryption doesn't work, or just any kind of leakages and problems happen. So the member states definitely have their own national laws and safeguards, but maybe across European support and recommendation could come in handy. And again, it's not directly connected with data, but rather the evidence to show that one type of application or service is ready on the market, is ready to be scaled up and used by a wider range of users. So the fast track, or any kind of track actually, to certify and reimburse for the digital health solutions is very much expected on the market. And besides DIGA and some other national models, the stakeholders certainly look for some kind of common criteria or advice on how to get these health innovations to be used wider and far across Europe. So this is my take, a very, I would guess, subjective selection from the sources that I mentioned. And I'm happy now to take your reflections, Katja and Licinio, and also, of course, the participants. Please raise your hand, put your comments in writing, and take part in this opportunity. We still have 30 minutes at least for discussion. So Licinio, I can see you on the screen just by accident. Do you have any comments on these remarks?
Well, those are perfect. These remarks are really the kind of things that we want that we need to build the discussion forward. Is there any chance you can bring them up so that we can follow them and actually pinpoint what we did or what we tried to do in order to address some of these aspects?
Absolutely.
Would that be feasible?
Yes. If we can just take back the slides, and then coming from yes. I'll just go back to where I started, and I think this is probably one of the syntheses. If you have comments on that,
yes,
please do.
Katja, would you like to go first, or should I give it a first try?
Well, I can just quickly maybe mention that I hope that the notion of secondary of reuse is clarified, because that is something that is also defined in the DGA as a baseline, and of course further elaborated in the EHDS. Please, Licinio, continue.
Pre-proposal being published, so this is not the very up-to-date synthesis, I need to admit. Any more comments from Katja? Or
Sorry, I
Licinio?
was muted, and that's why. But it's a good slide. Now it's not there anymore, but it's a good slide to give you a concrete understanding on how we try to bring up the difficulties that TED has found and how TED has contributed significantly for what we did in our study. So I don't have the slide there, but because I would like to go one by one. So indeed, we try to take forward the idea what secondary use of health data mean, and in particular, for what purposes these are included. So we try to define, to have a closed purposes for secondary use, and that's our Article 34 in the regulation. I don't know if there are any, well, the slides would be really nice. Okay. So in terms of GDPR, there is different preferences on the legal basis. And what the European Health Data Space legislation proposal brings is a common legal basis that can be used by health data access bodies. This is extremely important to understand. What this means, and this is possibly one of the major game-changing things, is a data user that can fall in one of the categories that we, regulator, data researcher, innovator, requests a health data access body. I would like to have access to this data for this purpose. If all the preconditions in all the requirements, security, safeguard, ethical, scientific, are there, the health data access body can issue a positive permit. And by issue a positive permit, it means that the health data access body will request the data from the data holder, the ones that hold the data, and bring the data to a secure processing environment. And the data will be processed by the health data access body using as legal basis this regulation. Okay, so this is one of the game-changing or game-shifting things, how it complements, it provides a common legal basis for the processing of health data. That's the spirit of what we put in the proposal.
Licinio, can I ask if the FinData in Finland and Health Data Hub in France are already serving that kind of purpose? They are called data intermediaries, and I think they are very much connected to Data Governance Act, which established the role and the mandate of this kind of bodies. So do you foresee similar bodies coming up in each and every of the member states?
Thank you for that question. France and Finland, in this particular case, are really bright stars in our sky because they show us a path that can lead us to success. And we inspired on that. And that's why in Article 36 in the regulation, we propose that member states shall designate one or more, there are different, responsibles for granting access to electronic health data. That's exactly what FinData and French Health Data Hub are. They provide grant access to data. So yes, those are two beautiful examples of these health data access bodies and what they should do.
Mm-hmm. In the chat, we do have a question from Diane. So our participants here are mostly the technology providers or belonging to the stakeholder communities, sometimes called reference sites or hubs or clusters. And they are asking, where should they put the utmost of attention in the long and winding regulatory texts? What is for them, the service providers, the SMEs, the very topical thing to be looking at?
Katja, would you like to give it a try? Or?
Well, in general, at least for the Data Governance Act, now that it is published in the official journal and will come into force at the end of this month. So there will be a dedicated website, the Commission website, explaining the DGA in easier terms. So that might be helpful for the EHDS. It's then Licinio for to tell more for the time being where to look for information. And maybe I could also add on the point I saw on the slide, there was a point on poor data management from the Tehnopol report. Something that the DGA has aimed to do is to have these very flexible structures for the member states on how to enforce the DGA, and for example, chapter 2, which is on the reuse of publicly held protected data. There we speak of competent authorities, and the provision is really rather flexible. So the member states have a lot of flexibility in terms of deciding which body will serve as such a competent body. Will it be an existing one? Will they set up a new one? What kind of a form it will take? And this is really to allow the member states to resort to the entities that have the knowledge and expertise to assist the permit authorities, so the public sector bodies who will be then granting the reuse permits.
Yes, just as a remark for your information, in Estonia we don't have this kind of institution yet, so I'm very much looking forward to it being formed. There is another question to both of you, Katja and Licinio, thanking for very interesting presentations. Indeed, I think that goes for all of us. But are DG Connect and DG SANTE involved in the EIT Health steered Digital Medical Device Task Force? So there is a Digital Medical Device Task Force, and this bases its work on the German DiGA or DiPA legislation. And it is the work of vital interest for us as care providing industry, and for scaling up digital solutions, since this remains a challenge. So do you have an idea of alignment or collaboration with this task force? Katja or Licinio?
I'm afraid I'm not aware with the alignment with this specific task force. We are very well aware of the DiGA work, and that was kind of one of the inspiration for us to come up with Article 31, voluntary labeling of wellness applications. And what we want here is to ensure that whenever applications are prescribed as part of the treatments, as part of the continuity of care, the citizens, the patients that are looking to which are the applications out there could be a common way where they can look and understand how these applications protect data, how these applications are interoperable, and how the data collected can be further available, for example, for the integration with the electronic health records, so it doesn't become siloed in that application. And for us, so that's one of the important lessons we learned from the DiGA in terms of evaluating interoperability, security, and privacy of data apps.
Thank you very much. It's a very good information. Thank you, Eckhard, for putting it up, that there is a steering group developing, hopefully, the criteria and the procedures based on DiGA. So do we have any more questions, or Licinio, would you like to go back to the slides and take it from there? So if you can pull up my slides, and I will put
and we go to the
some of the challenges.
Yes. So I will well, even in the previous one, there is this aspect about no standardized data sharing agreements. And here, what we are trying to push forward with the regulation is to have this European electronic health record exchange format that defines 5 categories. It can be more in the future, but these 5 categories that were identified as crucial for continuity of care. And in those categories, there are specific interoperability specifications, semantic and technical, on how this data should be made available directly for patients, so fitting into the fundamental right of immediately access to electronic health record data, but also to allow providers to providers exchange. And this we are speaking about just going back there to the regulation so that you are familiar with it. It's Article 6, European Electronic Health Record Exchange Format, and the 5 categories of data we are talking about: patient summary, e-prescription and e-dispensation, laboratory results, medical images and images reports, and final but not least, discharge letters. So these are the 5, let's put this, domains where these agreements should be standardized all over Europe so that they can be, patients can have immediately access to electronic format and can share with other professionals they wish to, and health professionals can actually have access to this type of information collected in others. So this tackles a little bit the other point, taxonomy and ontology codes that are linked to this, let's call data sets specifically. I would stay here. I don't have specific aspects on data management procedures, but we possibly will detail this in the next slides, in the next recommendations. Unless there is any question from the audience.
There aren't currently, but since in this project we have developed data governance guidelines targeted specifically to assist the service providers in the domain to deal with their own data management, then we hope to build some bridges and to help along the data management practices and procedures as well. Of course, referring to the new regulation and the opportunities created by them. But maybe you want to comment on the next one, when there are several data controllers sort of in the service chain.
So, well, I don't have the slide, but here we want to bring in the health data access bodies as the main controller for the reuse of health data. So this would be the pillar of our proposal. The control remains with the health data access body, and this would be a common control in each country. That's, well, I'm not sure how further we can develop this. There is when it comes to the interplay with the medical devices regulation, it is a blurred line here, but we try to make it simple like this. So the European Health Data Space defines the requirements for electronic health records and also for wellness apps. And these requirements are on security and on interoperability. In particular, so everything, all devices that are electronic health records should comply with these requirements, and they will be assessed. There will be this kind of certification on this compliance with these requirements. And all wellness apps that relate, medical devices that feed in data into the electronic health record, this is very important, is when a medical device feeds data into an electronic health record, it should prove compliance as well with the interoperability and security requirements defined in the European health data space.
Okay, very good. And definitely the control with these data access bodies is concerning the secondary purpose, if I understand correctly. Yeah.
Correct. And the part on the other side is the digital health authorities, the control of this part that I mentioned on the compliance with the interoperability and security requirements when feeding to electronic health records is the other authority. It's the digital health authorities that we propose as well in the proposal here.
On this topic, we don't have any reflections in the chat. So moving on, I hope you can see the slides now
This
some
is
of the
one that is,
recommendations. Yeah.
yes, this is very dear to me. Really, really, really. I like this very much because it's challenging. It's not because it's easy, it's because it's challenging. So the data, certifying the data quality, the quality of data. So what, and guidelines on data, metadata labeling. So what have we done? In this legal proposal, we create an obligation, and this is also the potential to change everything. So what it says is, any data holder of electronic health data that goes in the Article 33, so you have the type of data, any data holder of that type of health data needs to communicate to the health data access body, I have this data. According to the European Health Data Space, I have this data. And in doing so, they need to present what we call a data set description. So a data set description is a minimum set of data that every data holder needs to communicate independently of being asked or not by data. You, as a data holder, you need to say, this is the source of my data, this is the scope of my data, these are the main characteristics, which is the nature, how it was collected, and conditions for making this electronic health data available. This is Article 55, data set description. So this data, this is a small thing. It's not a big data set, it's a small one, because we know how hard it is to provide metadata. But what we are creating is the foundation so that all data holders communicate to the health data access body at national level. We have this data. So the outcome of this is that every citizen in Europe, when looking for data, will be able to discover where can I find data of pancreas cancer survivors, or when can I find data about the liver transplant. So they will be able, because there is this obligation, everyone except micro enterprises, we can speak on that exception, everyone will need to say, I have this type of data. But that's not quality, that's discoverability. So in terms of quality, we came up with Article 56, that is data quality and utility label. It's a voluntary, at this point, it's voluntary, and it has three purposes that I would like to share 2 minutes with you on this. Sorry if I'm taking long, because this is really exciting. So the data quality, the first thing it tries is the following. If I am a consumer and I'm a data user, and I want to find data, and I will have millions of data sets in all Europe, because we need to imagine that this will be all data holders in Europe, how can I distinguish the data sets that are useful for me, that have the necessary quality that I need for my purpose? So what we are trying to build here is to create this label where you can assess how do you fulfill certain requirements, characteristics of data quality. And what is the outcome of this? The first one is truly important, is that the data users, the ones that are looking for data, can see, okay, this data set has low data quality in this dimension, this is not okay for me. I need to have higher levels of quality. So this is one thing, is creating transparency for data users when looking for data. That's the first goal. The second goal, and not less important, is the data quality label should not be like 1, 2, 3, 4, 5. It should be quantitative, but more important than that, for each characteristic, like for example, how was my data collected and how it was managed? One of the examples that you show in the first slide that is limited. How this data was governed? Requirement for bronze level. Well, there is some kind of procedure that collects and treats data. Requirement number 2, you go to gold. Well, there is a structured procedure with a revision process. Requirement number 3, there is a full system that is peer reviewed by someone to ensure quality. Platinum level requirement, there is an automated system to check for consistencies and inconsistencies in the data and report on that. So it provides us a maturity model for data holders to say, okay, today I'm just bronze, but I want to move. So what do I need to implement to get there? So this second pillar is so exciting because it's a roadmap for improvement. And of course, funding opportunities will come. That's what we plan, so that you can, single data holders can improve the data quality. Say, I want to get to platinum, so what do I need to do? And there you have a roadmap. And the third aspect, it's important. People will immediately say, but Licinio, if you use data for training AI algorithms is different than the type of data that you are using for regulatory purposes, for example. And what our vision is, there will be a set of common data quality elements. And then what we have is these extensions. If you want to tailor your data set for AI purposes, you need to fulfill further requirements. If you want to go for regulatory purposes, there are other dimensions of quality that you need to fulfill, and these are the different levels of fulfillment of those. So why this is not yet at the most, because we say that this is voluntary for almost everyone, and it's only mandatory for data sets that have been created with public money. It's mandatory for data sets created by public money. For everyone else is optional. What does that mean? It means that you will not have a data quality label in all data sets. I hope this was somehow addressing the part that you were looking here.
It was, yes, very, very good to hear that there will be this kind of categorization and let's say, although voluntary, but still guidance on how to make data quality valid and happen in practice.
It's Article 56, data quality and utility label. It's how we call it. It's for reference for everyone. Article 56, 56.
Thank you. And I will draw everybody's attention that Licinio has also shared the consultation site, the website that you can click open and have your say, as all of us are invited to take part in the public consultation until July 28th. So the summer will be busy for data enthusiasts and those keen on regulation, because it really will be creating a lot of opportunities in the field. But since we don't have any direct questions in the chat, I think we are ready to wrap it up now. Thank you so much for these insights. Reading a regulation is one thing, but hearing about it really explained to you by people who have been very close to its development, it's totally another thing. I'm very, very grateful that you could join us today. Thank you, Licinio and Katja. Good luck with all the consultations and all the proposals coming from the member states as well, because this period will be ahead of us. And let's hope that our stakeholders and today's participants will also take an active role, being from the ground level the service providers of services. So from our behalf, we thank everybody for joining. And as we said also, and have the permission of Katja and Licinio to use the presentation slides and the recording on the project website. The link has been shared in the chat. In a few days this will be up, and we hope to keep in touch with all of you in terms of data governance, the regulations, and the overall project activities, which are plenty to pursue in support of scaling up the active and healthy aging. Thank you.
Thank you. It was a pleasure.